Hi there, I'm Dr. Marissa Caudill back to talk with you today about omega-3 supplementation in children. And this is a topic that comes up a lot in my practice where parents want to know, how can I treat my child first, maybe with a non-prescription option, either for their ADHD or their mood or anxiety problem or for another concern. And so today I'll be talking with you about omega-3 fatty acids because this potential supplement has the greatest evidence in terms of a research base in helping with these conditions in kids and in adults, in addition to a lot of other medical conditions. So let's dive in. What are omega-3 fatty acids? These are essential fats, and what that means is that they are fats our body cannot produce. We have to get them from our diets. And they're also known as healthy fats because unlike saturated fats, which cause lots of health problems like clogged arteries and fatty liver and other things like that, these fats are good for us. And we can get them from a few different sources. ALA, or alpha lipoic acid, is one that comes from plant-based sources. EPA, or eicosapentaenoic acid, comes from fish and marine sources. And DHA also comes from fish and marine sources. Classically, as humans were hunter-gatherers, they typically would live near water sources, and more of our calories came from fish and things that had EPA and DHA in them in the past than currently. And so there have been a number of studies, especially in looking at kids who have inattentive symptoms or hyperactivity symptoms or behavioral problems, showing that their blood levels of these compounds are lower than what we would otherwise expect, and therefore hypothesizing that this could be part of the problem, and supplementing with EPA and DHA might help resolve some of these symptoms. So what do we know? We know that our bodies can convert some ALA from our diet into EPA and DHA, but only in small amounts. So the vegan sources of omega-3s are not as rich in EPA and DHA. Does that for sure mean they're not as good? I don't really know, but I generally recommend that people try what we know has worked, which is supplements that contain EPA and DHA, so long as there's no problem like a fish or shellfish allergy that could potentially result. And we know that these generally are very safe. They've been tested, and if you're under a dose of 5 grams, which is 5,000 milligrams of fish oil a day, you're pretty much going to be fine. Mild side effects can occur, like aftertaste, burping up a fishy taste, your sweat kind of stinking like fish, which is gross, but okay, and not dangerous. But if you're someone who's an adult on blood thinners or a child on blood thinners, that is something to discuss with your doctor because these medications in high doses can also thin our blood a little bit. So what we know is that omega-3 fatty acids are these special kinked fats, meaning they're not just straight chain fats, they have little bends in them. And what that means is that when these kinked fat molecules incorporate into the cell membrane, and if you remember back to biology class, we have a lipid bilayer with hydrophobic tails and hydrophilic heads, and that's on every cell in our body. And that lipid bilayer is where these omega-3 fatty acids live. And by poking themselves in there, they make the fatty bilayer more fluid, and they allow proteins to move more freely, and communication, especially from nerve cell to nerve cell, presumably to happen more efficiently and effectively. So what's the evidence that omega-3 supplements can help kids? So there's plenty of evidence that omega-3 supplementation can help with many medical conditions ranging from heart disease to stroke to cancer to dementia to eye problems like dry eye or macular degeneration. But there's also a lot of evidence that omega-3 supplementation may help mental health disorders such as anxiety, depression, ADHD, and prodromal schizophrenia. For our purposes today, I'd like to focus on 3 things, specifically ADHD, mood problems like depression, and schizophrenia. So let's talk first about omega-3s for ADHD. If you're a parent who has a child who's either been diagnosed with ADHD, or if you have a child whom you suspect might have ADHD, or even a child who's just struggling to focus, you may want to consider trying a 12-week trial of omega-3 supplementation. I think this is generally extremely safe and unlikely to cause any problems. The main issue will just be compliance and getting your child to tolerate taking it. The goal dose here would be 600 to 1,000 milligrams of EPA daily, with a ratio within your fish oil supplement of over 60% EPA compared to DHA. Now, most kids can't swallow the big fish oil capsules that you would buy from the store. So on my website, I'll give you a link to a couple liquid supplements that are pretty well tolerated by kids. And these have been tested as well by Consumer Labs, which is a watchdog organization that tests all of these products to make sure that they contain what they say they do. As you probably know, the Food and Drug Administration and our government does not regulate any of the supplements that are sold in our country, and this is a multi-billion-dollar business. So if you're going to spend money and try something, I want you to be sure that you're getting something that really is what it purports to be and that's likely to be helpful. And for that reason, I recommend 2 particular products. And you can find the links to those on my website. There will also be a link at the end of this video. Okay, omega-3s for mood. Treating depression with omega-3s has also been successful. And in fact, omega-3 supplementation of all the supplements out there has the best evidence for being helpful in treating depression. They also can be taken together with antidepressants or other SSRIs and improve outcomes and improve remission rates in depression. It seems like when you treat depression with mild severity, it's a little bit harder to see an improvement with omega-3s. But for people who have moderate to severe depression symptoms, those outcomes really seem better with omega-3 fatty acids. And even omega-3s alone, without other prescription drugs, can be helpful in treatment of depression. There is some evidence, the studies are mixed. There's some that really suggest it works, and there's others where it doesn't seem like there's a difference between placebo. What it seems is that people who are deficient in omega-3s in their diet are more likely to benefit from taking the supplements. And that makes sense, right? If you're already getting a good amount of fish and your body and brain have plenty of omega-3s, taking more doesn't really make a difference. The people who experience the most positive effects are the ones who don't have enough omega-3s, who then are made whole by taking the supplements. So the best evidence, and I find the most exciting evidence for the usefulness of omega-3 fatty acid treatment in mental health, is in treating young people who are at risk for schizophrenia because they have a relative with schizophrenia. As you know, schizophrenia is a very serious mental health condition in which people can experience symptoms like hallucinations or delusions, and it affects about 1% of people, and it can be quite impairing to their function. So there are many people who study children of people who have a psychotic disorder like schizophrenia and try to see how can we prevent them from developing this disorder as well. And one group has looked at kids and young people ages 13 to 25 and supplemented them when they started to exhibit some symptoms that we call prodromal psychosis. So typically, schizophrenia develops in late adolescence, and symptoms tend to be mild at first, and there's often a period of months or even years where people have prodromal symptoms. So it's not full-blown psychosis, but people may change in terms of their personalities. They may become less outgoing. They may have grades that decline. They may be less interested in activities that they used to enjoy. They might be exhibiting less interest in maintaining their bodies being clean, cutting their nails, grooming, those kinds of things. And what they found is that supplementing people who were exhibiting some of those symptoms but didn't yet have a diagnosis of schizophrenia with high doses of omega-3, 700 milligrams EPA and 400 milligrams DHA in this study for 3 months, significantly reduced the risk that over the next 9 months, those young people would go on to develop psychotic symptoms. The risk went from 20.9% of those participants in the placebo group down to 4.9% of the kids and young people who were treated with omega-3s. And they followed up the same group of people 7 years later and found that there was still a benefit. Only 10% of the treatment group had developed schizophrenia, whereas 40% of the placebo group had a diagnosis of schizophrenia. I find this quite remarkable. And I think it's just strong evidence that omega-3s really do something positive in our brains, especially at periods where our brains are changing a lot, like in adolescence, and they can be very helpful. All right, so please go to my website. There's going to be a link at the end of this video that'll take you right there, and check out the resources tab where I'll give you more information and links on how you can purchase these medications over the counter. Sorry, supplements, not medications. And feel free to message me there as well if you have any particular questions about using these medications. Take care.